So good afternoon, students and colleagues, and thank you for taking the time to join in on this first session of the Interprofessional Practice and Team-Based Care. I'm Dr. Sarila Ramklas, and I'm from the School of Clinical Medicine. And together with our interprofessional team colleagues across the college, we have decided to introduce this special educational clinical training feature for students in the College of Health Sciences. So today's session is an introduction to what interprofessional practice is all about. There will be a live streaming of a video that we've produced, and part of that video recording gives you insights into the different professions that we have within the College of Health Sciences, and many of whom you are probably engaging with or seeing perhaps in the clinical environments in which you work. So in a few minutes, Mr. Ntuli is going to start the video and for us. But before I leave this platform, I just want to say that at the end of the video recording, you will be given an opportunity to interact with myself and other team members who have been part of this process. And so you'll be allowed to ask us questions either in the chat or you will be able to unmute. And at the end of the session, we have a poll, which we would like for you to engage in. So enjoy, and we look forward to chatting later on. Thank you. Musa, over to you. Good afternoon. I'm Dr. Sarila Ramklas from the School of Clinical Medicine. I'm the coordinator of interprofessional practice and team-based care in the College of Health Sciences. Welcome to this first session in a series of presentations on interprofessional practice and team-based care. The presentations are scheduled for once a month from March until the end of the year. These presentations are scheduled within your clinical education hours, and so students are encouraged to attend. And they're specially designed to improve clinical problem solving within a team-based approach in the healthcare environment. So let me tell you a little bit more about the series that's planned. Today, I will provide an overview of what team-based care means and how it will contribute to improved patient outcomes as part of your clinical practice. Subsequent presentations will involve discussions by clinicians on a variety of patient cases that you encounter in your clinical exposure. So we will be using paper cases of patients in a variety of contexts, and team members will be selected relevant to the patient condition to describe the management approach to the particular condition. All right, today's presentation will, as I said, begin with an overview of interprofessional practice. It will be followed by short video clips from the different lecturers in the different disciplines within the college, who will give us a snapshot or share their contribution to practice within a team approach. Just to say that these sessions are scheduled within a lecture slot or within your clinical education hours, and so you are encouraged to attend. All right, let me then begin with the overview of interprofessional practice and team-based care. So, what is this interprofessional practice, and why do we need to know about it? So, by definition, interprofessional practice is when members and students of a profession learn with, from, or about each other to improve collaboration, for improved quality of care and services. And why do we need to learn about interprofessional practice? So, as healthcare professionals, we know that patients are complex, often presenting with a range of dysfunctions. There are concerns about the quality and safety in healthcare delivery globally. And according to the World Health Organization, these deficiencies cannot be addressed by any health profession alone. There is also a lack of knowledge of professional practice. Students and qualified professionals have a superficial understanding about the roles and responsibilities that colleagues from other health science disciplines bring to the patient encounter. Yet, they work in the same clinical space, most times on the same patients, but they formulate their own individual treatment outcomes for the same patient. So this talks to a lack of collaborative practice. Then we speak often of patient-centered care. But how then do we practice patient-centered care? If a key attribute of patient-centered care is having awareness of the knowledge, skills, and roles that other disciplines bring to the clinical setting. How should we learn about interprofessional practice? So it's said that it's best learned in clinical practice when you're working on a clinical problem. So let's take an example of a diabetic patient as the clinical problem. Let's go back to the definition of interprofessional practice, which states that members and students of a profession learn with, learn from, and learn about each other. Now, let's take a diabetic patient as a clinical problem in this instance. Who will be part of this diabetic team that you will learn with to discuss this clinical problem? So in the case of the diabetic patient, the clinical team might constitute the physician, the nurse, the pharmacist, the physiotherapist, the occupational therapist, the dietitian, maybe a psychologist. And what will you learn about in your conversation with each other? Within a team approach, you will learn how each profession contributes to the understanding of diabetes for that patient. Now, this is shared with the team because there is an assumption that everyone on a team knows what the other person does, but that's not usually the case. And what does it mean to learn from each other? So learning from each other relates to the specific members that are selected to contribute to the particular problem presented by that patient. Right? So this is how interprofessional practice is applied to a particular clinical problem, when we learn with, learn about, and learn from each other. What are the skills required for interprofessional practice? Well, the first skill talks to communicating clearly. The second is that team members should have skills for effective problem solving. Because we're working in a team, there must be honest negotiation, and there ought to be realistic planning. And for us, as academics, we realize that many of these skills have to be taught, specific for interprofessional practice. The goal of interprofessional practice is shared decision-making. And who is this decision-making shared amongst? It's shared amongst the patient, their caregivers, and the interprofessional team. Because this requires a partnership amongst the collaborating members. And to work effectively, one needs to have clarification of the scope of practice of each team member. We need to value the knowledge of each other's disciplines whilst working as a team. We will certainly need skills for conflict resolution. And we'll have to talk about collaborative leadership, meaning, is there just one person that leads the team, or is there joint leadership? Team functioning is important, as it must be in a responsive and a respectful manner. And within a shared decision-making process, we need to engage the patient as a partner, because interprofessional practice is a patient-centered, collaborative, coordinated approach to healthcare. All of these factors depend on good communication. So how is interprofessional practice structured in a health professional curriculum? So, learning about interprofessional practice begins at the stage of exposure and awareness, followed by immersion, and then mastery, which comes with application. Team-based learning is a strategy used for introducing students to interprofessional practice. But more specific, we're talking about case-based team learning. So this prepares students for the second and third stages, which are the immersion and application stages for practice. Now, as I mentioned earlier, in this series of lectures, you will be introduced to case-based, team-based care, right? Where we will be using paper cases of patients, and you will watch the discussions around key members of the team as it relates to the selected patient. You will watch the team dynamics. You will hear how respect for each other's professions are exhibited. And you will also hear how shared decision-making is produced in a team-based encounter. All right. So the next up, you will watch short recordings from lecturers about their disciplinary roles in the healthcare environment. And following those videos, you will be given an opportunity to interact on the chat function. Thank you.
Basically, audiology is the field of healthcare or healthcare professionals that is involved in the prevention, identification, assessment, as well as management of hearing, balance, and related disorders. As you can see on the slide, hearing healthcare is a global priority as the prevalence of hearing disorders increases. As of the year 2021, according to the World Health Organization, over 5% of the world's population, that is over 430 million people, have a hearing disorder. This just goes to show how great the need for professionals in this field is. So, what does an audiologist do? As stated earlier, audiologists work with the identification of hearing disorders as well as provide hearing screenings. They work with the management of hearing loss and related difficulties as well as health promotion, which is an effort at hearing loss prevention. They also advocate for communication needs of all persons as well as do research and audiology education. So where does an audiologist work? The ideal work setting for an audiologist is the hospital. You can also find audiologists in schools, community health centers, private practice, in the mining sector, in the military, as well as universities. So in the university, you're going to find them as lecturers as well as researchers. And basically, with the audiology work, you are going to be working in a multidisciplinary practice. So that means you are going to be working with other health professionals as well. So that includes people like doctors. You are going to find people like educators, as well as speech therapists, occupational therapists, physiotherapists, and many.
Our communities, social, and economic structure. In other words, occupational therapists work together with people to enable and empower people to be able to do the things that they need to be able to do, have to be able to do, or want to be able to do. This ensures that people can participate in the occupations that give meaning and purpose to their lives. Occupational therapy uses occupations, or what people do, as a modality to promote health and well-being and address problems that a person may experience due to illness, physical or psychological impairment and disability. Occupational therapy also addresses adverse social conditions which may negatively impact a person's ability to function independently and experience meaning in their life. Occupational therapists work with people of all ages who experience developmental, mental, emotional, and physical disabilities, or those at risk of developing these types of disabilities. UKZN's occupational therapy graduates understand the importance of what people do in their person's development and functioning, and the link between what people do and health and wellness. UKZN OT graduates value goal-directed activity and the unique contribution that occupational therapy makes to the total care of clients from diverse cultures and contexts in South Africa. Finally, UKZN OT graduates gain experience in the primary healthcare approach and promote social justice by ensuring that people have the opportunity to engage in a wide range of meaningful occupations.
Ngizosho kabanzi mayelana nomsebenzi engiwufundelayo, abelaphi bezomsebenzi, phecelezi i-occupational therapy. I-occupational therapy isebenzisana nabantu ukugqugquzela ukuthi bazibandakanye emsebenzini yempilo, esiyaye siyichaze ngokuthi izinto ozenza usuku nosuku, okubalwa kuzo ukuzinakekela, ukuthokozela impilo, kanye nokubamba iqhaza emphakathini. Ukuzinakekela singabala kukho ukugeza, ukudla, ukugqoka njalo njalo. Ukuthokozela impilo singabala kukho ukubukela umabonakude kanye nokuyozithengela izimpahla. Ngamanye amazwi, lo msebenzi usebenzisana nabantu ukubasiza bekwazi ukuqhubeka bephile impilo efanelekile ngokubasiza benze lokhu ebese ngikushilo. Lokhu-ke kunikeza umuntu ithuba lokuthi aphile impilo ayifisayo noma ayithokozelayo. Ngiyathemba uyazibuza ukuthi ngabe lokhu sikwenza kanjani singama-occupational therapists. Sisebenzisa imisebenzi yemihla ukusiza umuntu ohlulekayo ukuzenzela imisebenzi yemihla eyedwa ngenxa yokugula, mhlampe okuba ukuphazamiseka ngomqondo, ukugula emzimbeni, emoyeni, noma ukulimala. Simfundise indlela yokuqhubeka akwazi ukuzenzela le misebenzi eyedwa. Abafundele lo msebenzi eNyuvesi yaKwaZulu-Natal bathweswa iziqu bayaqonda ukubaluleka kwezinto umuntu osuke egula akwaziyo ukuzenza bese bezixhumanisa nempilo yomuntu. Besebenzise lokhu asuke engakwazi ukukwenza bemsize ukukwenza ukuze kulapheke umuntu akwazi ukuba utho emphakathini naseMzansi Afrika. Sengiphetha, abathweswa iziqu kule nyuvesi bathola ikhono lokuthuthukisa impilo ngokuqikelela ubulungiswa kwezempilo, ngokuqinisekisa ukuthi abantu banethuba lokuzibandakanya emsebenzini ebalulekile kubo. Ngiyabonga.
My name is Lingene Ngobo. I am from the School of Nursing and Public Health, specifically the discipline of nursing. The discipline of nursing is located at Howard College, Desmond Clarence Building. The discipline of nursing runs programs from undergraduate level right up to the PhD level. The role and the responsibility that I mainly play within the discipline is that of an academic. And the reason why I have been invited to be part of the group, I believe that mainly it's because of my previous involvement with the interprofessional training projects through the SWITCH program, and also knowing that nurses are the backbone of any healthcare system, so there's no way that a nurse cannot be part of such a group. And because we are all passionate about or striving towards improving the clinical outcomes of the patients, so hence I'm part of the group. And because it is sad with the current situation that we are training all these healthcare students to be professionals in silos, yet after graduation we expect them to work together in harmony, yet they've never even interacted with each other. So I believe such a program will actually improve not only the patient's outcome, but also the relations and understanding within the healthcare team itself, because each member of the team will actually understand each other's scope of practice, and that will actually make things even much better, even for the patient, who is core for all of them. Thank you very much.
My name is Dr. Jodie Wells. I'm a general pediatrician. I have an interest in caring for children living with long-term health conditions and in those in need of palliative care. I'm based at Queen Nandi Regional Hospital. So Queen Nandi is a public hospital serving mothers, babies and children who live in the northern districts of KZN, namely King Sitwayo, Zululand and Mkanyikude districts. I represent the discipline of pediatrics and child health. This department is situated at the UKZN Medical School and provides training to both undergraduate and postgraduate students on various training platforms and at a number of institutions. Teaching and training is provided at eThekwini, at the Durban Complex Hospitals, at the Pietermaritzburg Complex Hospitals, at Queen Nandi Hospital, at Newcastle and at Stanger Hospitals. Pediatrics is the branch of medicine that deals with the medical care of infants, children, and adolescents. As a pediatrician, one needs up-to-date knowledge and clinical skills in the prevention and management of acute and chronic conditions presenting in childhood. And there is also a scope to become a pediatric subspecialist in a specific discipline, such as pediatric intensive care or cardiology, if that is your interest. So in general, as a pediatrician, one has to have the ability to communicate well with both the child, keeping in mind the developmental stage, and with their family. Pediatrics really encourages a holistic view of the patient, as the child always needs to be considered in the context of their family and their environment. It often requires close collaboration with other disciplines in order to provide holistic care. An important role of the pediatrician working in a regional level public sector setting, such as myself, is to have a good understanding of child health as a whole, which includes the community and public health aspects that impact on the health of the child. This includes in-depth knowledge of health systems and referral pathways. One has to have the ability to interpret health information and data in order to respond to the health needs of the children in the region through specific services and programs. One has to be able to advocate for services and to collaborate with other sectors and the community in providing care for the child. A general pediatrician will refer patients to a pediatrician when the condition is out of scope of their practice. At a specialist level, the pediatrician is often the first professional to become involved in the care of a patient and will refer to and coordinate the care provided by other professionals, including non-medical professionals and subspecialists. So in this way, the general pediatrician ensures that the patient gets all the input that is needed to manage their condition effectively and to achieve the best health outcomes. We are often called to give medical input on children presenting with surgical conditions, and so may, in some cases, be the secondary doctor managing the patient on the team.
Hi there, my name is Sithembiso Plose. I'm one of the lecturers in the discipline of physiotherapy in the School of Health Sciences. We are located at Westville campus. One of our roles and responsibilities is to produce the next generation of physiotherapists for South Africa and the world in general. In doing so, we try and ensure that our students and graduates are trained to be able to manage patients that would present with various conditions and using a holistic approach. These conditions would include neurological, orthopedic, cardiorespiratory, to mention a few. The whole aim of what we do is to make sure that we try by all means to maximize the quality of life of our patients. Hence, we're able to see patients from acute to chronic conditions. The conditions that we see includes your acute and chronic back pain, fractures, HIV, stroke, cerebral palsy, just to name a few. In managing the patients, we teach our students to do an in-depth assessment of patients, taking the present and past medical history into consideration. Once this has been done, our students are then trained to also clinically reason and then use the information obtained from the patient's assessment to identify impairments and limitations, and then formulate goals that would assist in ensuring that the patient is able to go back to a workplace or in their communities and to be able to function independently and maximally within their own settings at home. I was fortunate enough to be one of the people to be part of the health teams. Based on my experience and knowledge that I've gained over the years working for Department of Health, I'm at a position where I'm able to share my experience and what I've gained over the years as I've been exposed to different levels in the Department of Health, ranging from your community level all the way to a provincial level where policies are formulated and monitored. This knowledge will help us working together to ensure that the quality of graduates and healthcare professionals that are produced are those that are suitable for our current setting and are able to formulate outcomes that would be able to address the needs of a patient and community in general.
Afternoon, everyone. My name is Prof. Lem Marais. I'm the head of department for orthopedics that's based at the School of Clinical Medicine. So orthopedics has to do with injuries or disease of the musculoskeletal system. So we deal with bones and joints and ligaments, tendons, muscles, nerves, of the limbs and the limb girdles and the spine. So there's about 15 hospitals in the province that has orthopedic departments. So we're based at most of the regional and tertiary hospitals. There's quite a few sub-disciplines in orthopedics. So our major burden is orthopedic trauma, where we deal with fractures and dislocations and joint injuries and ligament injuries. But there's also shoulder and elbow surgery, hand and peripheral nerve surgery of the upper limb, spine surgery, arthroplasty, which is joint replacements, and then lower limb joint reconstruction. That's like knee ligament reconstructions or hip reconstructions. Foot and ankle surgery, pediatric orthopedics, which is quite a large part of our work, and then also orthopedic oncology and infections. So typically we will get involved in patients' treatment when the patient's referred to us from a general practitioner or other specialities. That is noticed the patient's got a musculoskeletal problem. In fact, in some studies has shown it's the number one reason patients go to a GP is because of a musculoskeletal problem. But then we also often refer patients from physiotherapists and occupational therapists and other healthcare workers who deal with patients with musculoskeletal problems.
As a speech language therapist, you get invited into a team either through a referral system or by other professionals whom understand your role within the team for quality patient care. So in essence, when our role is clearly outlined, though we do have gray areas and shared roles within feeding and swallowing for pediatrics and adults. So there is some gray areas that are shared with other professionals such as the OT, the dietitian. So it's important that we get referrals or we are invited to participate in managing these clients. So at the moment, we solely depend on referrals from doctors, from other healthcare professionals. Thank you.
Hi, I'm Kashina Naidu from the Department of Family Medicine, which is in the School of Nursing and Public Health. I'm a lecturer and a clinician. I am the academic coordinator for the 4th year undergraduate medical student module in primary healthcare. So we teach ambulatory care to medical undergraduate students in decentralized sites. This involves 6 community healthcare centers in eThekwini. I also run a diabetic clinic at Wentworth Hospital, which provides integrated and coordinated care to diabetic patients. Our current team involves dietitians, physiotherapists, pharmacists, and we currently have biokinetic students from UKZN who also contribute to patient care. In our undergraduate teaching, we focus on ambulatory care to patients with chronic non-communicable diseases. So this includes conditions such as hypertension, diabetes, asthma. As family physicians, we are not limited to seeing patients with specific conditions. So we see patients at primary healthcare level who can present with a multitude of conditions, and therefore we often liaise with other healthcare professionals. Apart from clinical care, family physicians are also involved in clinical audits and quality improvement projects. These involve engaging with multiple stakeholders to improve the quality of patient care and also for health system strengthening. Apart from outpatients, family physicians are also involved in inpatient care of patients at district hospitals, as well as palliative care. So I look forward to learning more about how to promote interprofessional learning within our college. Thank you.
Hello, my name is Dr. Takshita Sukun. I am a senior lecturer within the discipline of Biokinetics, Exercise and Leisure Sciences, which falls within the School of Health Sciences in the College of Health Science. Within the discipline, I also serve as the research coordinator and the biokinetics. Within the discipline, I also serve as the research coordinator and the biokinetics intern supervisor. We are located on the University. What is a biokineticist? A biokineticist encompasses life through movement. It includes the science of movement and the application of exercise in rehabilitative treatment of performance. The primary function of a biokineticist is to improve physical functioning and healthcare through exercise as a modality. The biokinetics profession is concerned with health promotion, the maintenance of physical abilities, and final phase rehabilitation by means of scientifically based physical activity program prescription. A biokineticist is a clinical exercise specialist who functions within the Professional Alliance to Health and Medicine and is recognized by and registered with the Health Professions Council of South Africa. These individuals improve a person's physical well-being and quality of life through individualized scientific assessment and the prescription of exercise in rehabilitative treatment to prevent or intervene with certain ailments and the enhancement of performance in both sport and work. We also evaluate and measure body posture, body composition, blood pressure, glucose levels, lung function, heart rate, fitness, muscle strength, endurance, power, flexibility, and other health screenings. We are also involved in health promotion and wellness to create better quality of life for people we work with. An individual's movement may be diminished or lost due to hereditary, aging, injury, or disease. Such loss may occur gradually over the course of a lifetime or traumatically in an instant. Conditions of movement loss that are linked with chronic and disabling diseases pose additional challenges for patients and their families. We all know that movement is an essential part of everyday life for people of all ages. Movement affects development, learning, communicating, work capacity, health, and very importantly, quality of life. Movement permits people to navigate and stay orientated within their environment. It allows people to interact more fully in their work and recreation. It is the defining element of quality of life. The profession of biokinetics has evolved as a health profession responding to the universal need of quality, accessible, cost-effective health care. Biokineticists are widely distributed in communities around the world, and they provide economic value for services they offer, as well as detect a wide spectrum of conditions.
Hi there and welcome to the discipline of optometry. My name is Dr. Ibrahim Khan and I am the academic leader for optometry, which is part of the School and the College of Health Sciences based at the University of KwaZulu-Natal. We are based on the Westville campus on floors 5 and 6 in Block E. We also have an in-house clinic on campus, which is based on the 5th floor of Block E. What is optometry? Optometry is the healthcare profession concerned with examining the eye for defects and faults of refraction to prescribe correctional lenses or eye exercises, with diagnosing diseases of the eye and treating such diseases or referring them for treatment. Optometrists are concerned with prescribing glasses or spectacles, and we prescribe these for people who have a refractive error. You find that we can prescribe from children to adults, all different types of lenses. We also prescribe contact lenses. These could be hard contact lenses, soft lenses, multifocals, a hybrid lens, which is a type of lens that incorporates both soft and hard, as well as scleral lenses, which are much bigger. They sit over the sclera. We also are regulated by the Health Professions Council to prescribe telescopes, magnifiers, microscopes. Also, we are quite involved with color therapy lenses, as well as other types of therapy. If there's a binocular misalignment or if the power of the eye is not to age-related norms. We also work very closely with other disciplines to pick up pathology. So we have a look to see if any of the systemic diseases such as diabetes, hypertension, cholesterol, all of these things have an ocular effect as well. So we look out for these things during our routine eye tests. Other things that we look out for could be eye misalignments, could be a cataract. Cataracts are when the intraocular lens or the eye within the lens within the eye becomes cloudy and not so clear anymore. You also find another condition that is quite common is something called blepharitis, which kind of looks like dandruff on the eyelashes. Or you could also have other types of pathology like an incomplete iris. And we work closely with other professionals to try and assist so that the patient is able to see clearly thereafter. If surgery needs to be performed, we refer the patient to an ophthalmologist. Our students are very involved in learning all types of therapies and procedures from first year to final year being their 4th year. It's a 4-year degree. It's an honors program. And our students learn on campus in the clinic. They also go out to other clinics off-site, Department of Health clinics, as well as they perform a lot of community service. Our students are also quite involved in therapy or treatment or prescribing of therapies. So if they pick up a problem, sometimes they may need to create some sort of like an eye gym for patients to be able to come through and work their eye muscles. You know, like how you go to the gym to work your other muscles, you can also work your eye muscles. And our students are trained to do this properly. They also learn how to look at the back of the eye in order to pick up any pathology that may present on the retina, as well as in the anterior portion of the eye by using something called a slit lamp biomicroscope. This is half of the final year lot from 2022, and as you can see, we're a very happy bunch. Thank you for listening. Take care. Bye-bye.
All right, so thank you very much, Musa. Right, so that was our introduction to interprofessional practice and team-based care. Do you have any questions? You're welcome to unmute, raise your hand, or just type a question in the chat box. Are there any questions, Ishana?
No, Sorella, I can't see any questions at the moment.
All right. Okay, yes. Okay, so we must apologize because I think pharmacy was omitted from the video, and we certainly had a pharmacy video. We will certainly rectify that for the next time, Prof. Naidu. I'm sorry about that. I'm not sure what happened there. Students, do you have any questions? Any comments? Oops, and dietetics as well. All right, so Lucetta Elipin has a question which says, is this an approach for the public sector? So no, it's not an approach for public sector per se. It is, remember that this is a healthcare approach. So it would be an approach that is encompassed across both the public and private sectors. All right, so not just the public sector approach. All right. Any other, does that help? Yes, Ms. Elipin? All right, great. Any other questions? Okay, so if there are no other questions, and I think we're just going to ask, okay, so let me just tell you what's going to happen next. We're going to have a series of these sessions. So the next time we will host the session will be around a clinical case. And the clinical, so this will be next month, again on a Thursday afternoon. Usually it'll be the third Thursday of the month. And we will then have a discussion with team members around a particular paper-based case. Okay, so that's the plan for the rest of the year. Okay, so thank you for your comment, Samakaliswa Nala, who says that the presentation was very informative. Yes, unfortunately, there have been some omissions, I think, in the production of the video, but we will certainly rectify that for the next, prior to the next session. All right, so I do apologize. So pharmacy, for instance, and dietetics actually did not, it was not represented, and we did receive a video. So I'm really sorry, Dr. Biggs and Prof. Naidu. We will certainly rectify that for the next session. All right. If there are no further questions, we've got a very short. Oh, is there another question? Let's see. No. All right. So if there aren't any further questions, do you want to ask the panelists anything? Perhaps, do you want to get clarity on a particular profession? So panelists are here, are present. All right. So thank you for that response, Dr. Elizabeth. Okay. Right, so I'm going to ask that we run a poll now, with just a very quick poll, just to get a general feel of what you thought about this particular presentation, and whether you thought that it's going to help you and enhance your clinical practice as you work within the team. All right, so Musa, can we just run the poll, please? Okay, the poll's on your screen now, and there are just 3 questions. So if you could kindly respond, we'd be grateful. Thank you. All right, so Musa will end the poll. And just to say, right, so thank you. The poll results are in, and the attendees found the session very relevant. We had most responses for very relevant, and 93% of the attendees thought that the information shared was very useful, and 99% said that they looked forward to attending future sessions. So thank you very much for your attendance. Thank you very much to the team members who helped put together the session, and for the videos and all of the hard work that went behind this. And we look forward to joining you on our next session. Look out for the adverts that communicate the time and date for that session. Goodbye.